Ladies and gentlemen, let's get our applause ready. We have someone truly special joining us today. Get ready for an inspiring and effective session. We welcome, with immense pleasure and excitement, Dr. B. Rajashekar sir, one of the experts in the field of psychiatry. Give him a big round of applause.
Hello. Respected Principal Sir, Vice Principal Madam, Jaya Madam, Shanta Madam, all my senior uh, faculty members, my colleagues, and dear students. I'm going to talk about the gut-brain axis. From the morning, since the morning, you have been listening to the physiological and the biochemical aspects of that. But now let us come to the applied aspect, like how it actually translates into our clinics in our day-to-day practice. Next. Yeah. So before starting my presentation, I just want to declare that I don't have any conflicts of interest. See, for the understanding of students, what is conflict of interest? Conflict of interest basically means how my presentation is likely to be influenced by other things in my life. For example, if some particular, in this context, I'm going to talk about some clinical aspects. So is there any possibility that somebody has given me some money to talk positive about this particular aspect of gut brain health? So I want to declare that pertaining to this presentation, I did not get any sponsorship or any money. Okay. So if you talk about the various health problems, these are the gamut of disorders where gut brain axis is implicated. Coming to my specialty, it is mostly in the context of depression and other mental illnesses. Also obesity, because obesity is very closely linked to mental health, and apart from the various other medical aspects. Irritable bowel syndrome, and also headache and migraine, because headache is one medical disorder which has got a lot of psychiatric or psychological underpinnings. So gut-brain axis has been known to be implicated even in this particular aspect. Next. So if you come to the gut-brain axis and psychiatric disorder, this was one very good study which was published in 2022. They have actually looked into the articles, which was, this is a 3-year-old paper. So 1993 to 2022, they have seen what are the various publications which are available worldwide. So amongst the countries, China has been the country which has been publishing max. I'm not talking about psychiatric disorders, but in general. So China is at the forefront in publishing issues related to gut-brain axis. And most of the articles are published in the journal called Nutrients. It's a very good journal. It's a PubMed Index journal. And these are the various 6 themes. And the most studied when we talk about the psychiatric aspects are depression, anxiety, and autism. Next. So if you see this graph, so if you see from around 2013 till 2013, it was actually a plateau. And then from 2013, the graph goes up and it is steadily growing up. So what is the reason for this surge in gut-brain axis research? So as depicted in this figure, in 2013, the NIH, means National Institute of Health, actually funded the human microbiome project. So parallel to that, now there is an upsurge of research worldwide. And there's now a lot of National Institute of Health, or even for that matter, ICMR. Now you'll be doing, in your first year, you are going to do STS scholarships, which are funded by ICMR. So very shortly, we'll roll out the things also. So you can probably take this up as one of the opportunities to do study in this particular field. So there's a very huge rush from various funding agency in this particular field. Next. So traditionally, if you talk to our ancestors, gut is a system, means GIT is a system which is related to the absorption of nutrients and excretion of waste. But how the advances in this field is actually showing that it has got a lot of neurological or neural, endocrinological, exocrinal, and also immunological functioning are there in this particular field. So gut-brain axis is basically a crosstalk between two aspects. The first one actually is the endocrine aspect, which is controlled by the HPA axis, that is hypothalamo pituitary adrenal axis. immunological, that is cytokines and chemokines. In the first presentation, Anita madam has very beautifully talked about this particular aspect. Third is the neurological, that is especially the autonomic nervous system. So on one hand is that particular aspect of the neurological aspect, and on the other hand is the gut microbiota, which I have shown in red. So this is the basically crosstalk between these two particular aspects. And there is a bidirectional signaling pathway which actually connects the, so nervous system basically are of two types, the central one and the intestinal one. I'll come to that slide later, which probably madams have already talked about. But it is basically this GPA connects the intestinal and the central nervous system, and it involves autonomic nervous system, HPA axis, and also enteric nervous system. So HPA axis, there are a lot of studies actually. If you see the figure here, unfortunately, this is not connected to that. Otherwise, I would have shown stress has an effect on the hypothalamus. I'm not going to go into much details. Probably when you come to my department, or if you go to neurology, probably you'll come to know that later. Stress has an impact on the hypothalamus. Hypothalamus leads to increased secretion of CRF, that is corticotropin releasing factor, which activates the pituitary gland, which in turn leads to increased secretion of ACTH. ACTH has a stimulating effect on the adrenaline gland, which leads to increased secretion of the cortisol, and cortisol in turn has an effect on the gut. For example, this particular figure is mostly in relation to the IBS, the irritable bowel syndrome, which is a very common disorder which has got the physical as well as the psychiatric ramifications. So increase in cortisol has an effect on the gut functioning, tone, visual perception, and also the behavior. So next. So if you talk about the autonomic nervous system, basically it is of three types. Parts actually, sympathetic, parasympathetic, and enteric nervous system. So when we talk about the gut-brain axis, the third one, that is enteric nervous system, is the most important. Next. So it is called the gut brain or the second brain, and in contrast to the central nervous system, or similar to the central nervous system, most of the neurotransmitters are also found in the enteral nervous system. So around 30 neurotransmitters have been involved to be related to the enteric nervous system, and it directly controls the GIT. So the most common neurotransmitter which is implicated in gut-brain microbiome axis is the serotonin. So serotonin, for a common understanding, is a neurotransmitter which controls our mood. So if I'm feeling, let me put it in a very, very vague manner. So when we have decreased levels of serotonin, we feel sad. And it is found that those people who actually attempt or complete suicide have deranged levels of metabolites of serotonin, which is called FIA, that is 5-hydroxyindolacetic acid. So suicide or suicidal behavior is not just okay, something is saying, somebody is saying something and somebody is going and committing suicide. There are a lot of neurotransmitter implications there. So serotonin is a very important neurotransmitter when it comes to mood. And also it is a neurotransmitter which is implicated in the causation of sleep. So decreased levels of serotonin are generally related to sleep disturbances. So CNS functions are modulated by serotonin, which includes mood, depression, anxiety, and cognition. Cognition, basically, to put it very simple, it is a thinking ability. And serotonin, if you find, only 3% is found in the central nervous system, while majority of the serotonin is found in our intestines. So 95% of serotonin is found in the gut, and most of the serotonin is made up by the gut microbiota. So this is a very important slide for today's presentation. Next. So there was a very famous or ill-famous Walkerton epidemic, which was a town in Canada. In 2000, there was a flood, and it led to a lot of contamination of drinking water with certain bacteria like E. coli and Campylobacter jejuni. And around 2,000 such people developed severe GI infection and also irritable bowel syndrome. These people, over 8 years, found when this most of these people, during the next 8-year follow-up, what they found was that depression and anxiety was a significant risk factor for persistent irritable bowel syndrome. So basically what it says is some abnormality in the gut-brain axis, which was related to this severe infection by E. coli and C. jejuni, led to a lot of psychiatric issues, depression, anxiety, which was actually leading to prolonged irritable bowel syndrome. Next. So the brain gut dysfunction is very closely related to psychiatric disorders. So I'm not going to go into much detail, just one sentence about each. It is found that it leads to activation of immune response. There's a HPA dysfunction, and there is altered neurotransmitter or neuromodulator levels. Also, dysbiosis of gut microbiota is leading to increased vulnerability to depression and anxiety. And also it is very significantly related to irritable bowel syndrome and migrainous headaches. Next. So this is a very big slide. So this particular slide actually shows that apart from depression, there's a very significant association of gut-brain axis dysfunction with certain psychiatric disorders such as post-traumatic stress disorder, attention deficit hyperactivity disorder also. Next. So these are the various gut microbiota. I'm not going to again spend time here. The whole gamut of bacteria are implicated across various neurodevelopmental disorders. Here I'm going to just talk about autism spectrum disorder. Next. Next. Yeah. So changes in the composition of gut microbiota and microbial metabolites are associated with development as well as severity of ASD. The problem with autistic spectrum disorder is these children, like people with intellectual disability, the so-called mental retardation, from the birth, they are abnormal. They have congenital abnormalities and they are found to be abnormal from birth. Unfortunately, the children with ASD are otherwise normal till 3 years of age. And from 3 years of age, sudden deterioration in their system starts. But now there are a lot of studies which say that probably the dysfunction starts much early, even during the toddler period. And it is found that gut-brain axis dysfunction is very closely related to development as well as the severity of ASD symptoms. But we don't really know whether this is leading to that or that is leading to this. So that cause-effect relationship is not very clear, but one association is found. Okay. And what these particular researchers did in 2019 is the Kang et al. They have followed up 18 children who had autism spectrum disorder. And they found that fecal microbiota transplantation led to improvement in GI symptoms as well as core symptoms of ASD. So it is found that children with ASD, that is autism, have a lot of gastrointestinal symptoms, and such symptoms are known to improve when you do fecal microbiota transplantation. Okay. Coming to next slide. So psychobiotic basically are the molecules from the pharmacological perspective. These are live bacteria that when ingested in adequate amounts lead to health benefit in psychiatric illnesses. How do they help? They produce neuroactive substances such as GABA and serotonin, which act on gut-brain axis. So these are the psychobiotics are the focus now world over. They're trying to see how this particular molecule in therapeutic quantity should be given to people with diseases so that there is improvement in conditions. So basically psychobiotics are of two types, prebiotics and probiotics. So probiotics inhibit the colonization of pathogenic bacteria in intestine, while prebiotics contribute to the growth of beneficial microorganisms within the host. So there's a little bit of difference between pro and pre microbiotics, while synbiotics are the combination of these two. Next. So yesterday night, like this is one very common thing I do. Just a day prior to my presentation, I go to PubMed and then I do a literature search. So just yesterday night in PubMed is a very famous search engine like Google. I think many of you would be doing some publications down the line. So PubMed is a very prestigious search engine. So yesterday night I did a search with these two keywords, psychobiotics and mental illness. It led to 155 results. I have just narrowed down my search to only these two terms. And I have just selected reviews and systematic reviews because systematic reviews are considered the highest level of evidence. For example, I'm just seeing one patient today in Government Hospital Medak. I give some probiotic and I see improvement. That is a case report. So there are various levels of evidence. So as per the WHO, systematic reviews have got the highest level of evidence. Means it is considered something like a gold standard. So there were 96 results which were found till date on this particular two keywords. Next. So I'm going to talk very briefly about each disorder. Coming to depressive disorders, it was found that those people who received probiotics had lesser severity of depression compared to placebo. So placebo basically is a molecule which does not have any medicinal value, but the patient does not know what it is. So patient is actually receiving placebo as well as he is receiving the medical product. So patient is blind, but there are various levels of ways of doing it. But in this particular study, they found that the depression severity was less in the probiotic group. There was another study which was done in 2018. This was a randomized control trial. So randomized control trial basically means you are, for example, taking 100 patients. These 100 patients are randomly allocated to two groups. Nobody knows which group the patient will go into. So this the RCT was on, and this is again considered a very good level of evidence from the US FDA. US FDA is a organization in America which gives approval for medication to be launched world over for use in clinical population. So this particular randomized control trial was on 40 patients with depression. So what they did in this study was, for first 4 weeks, they have given an antidepressant called fluoxetine, which is an SSRI. And next 6 weeks, these were divided into two groups. One group received the probiotic with fluoxetine, the other group received placebo with fluoxetine. So what they found, the depression severity was less in that group which was receiving fluoxetine along with probiotics. So this means this is a blinded group, so people don't know what they are getting. So RCT is considered a very good level of evidence. This is another meta-analysis. Again, meta-analysis, what they do is, again, it is a much more better way of doing a systematic review. For example, they'll select 10 systematic reviews or 10 RCTs, and then they'll they'll do some statistical analysis. So in this particular, this is a very recent study, which was published in 2023, which is last 2 years back. BMC Psychiatry is considered a very good journal. It's a very high quality journal. And this is a meta-analysis of 13 RCTs. They found that there was a significantly improved, the depression improved significantly in that group which was receiving probiotics compared to that group which was receiving placebo. Now, next slide. So again, there are a lot of other studies. So this was about the what if the people are receiving some other antidepressants and you add probiotics. Then there was another systematic review which was done in 2019. All these studies are showing good results. Now coming to anxiety disorder, I have first talked about depression. Now I'm talking about anxiety disorder. Probiotics are significantly known to reduce the anxiety. This particular meta-analysis in 2017 shows that. There was another RCT, generalized anxiety. There are lots of anxiety disorders. So we just say that I'm anxious. No. Anxiety disorders, there are a lot of other subtypes of anxiety disorders. Probably when you come to psychiatry posting, I will let you know. So GAD is one of the psychiatric disorders coming under anxiety disorder. There they found that probiotic combined with sertraline was much superior to sertraline alone in reducing the anxiety. Next. So this was another very common study. I think this one probably we can do in our setup. So this was on postpartum depression. They have compared two groups where they have allocated one group to probiotic and another group to, which was on actually placebo. Again, they found that in comparison to placebo, those postpartum depression women who received probiotics were less severely depressed during follow-up. So there are a few other indications. Social anxiety disorder is another disorder where people feel anxious. For example, if I'm feeling very anxious performing in front of all of you, that is called social anxiety disorder. So it was found that probiotics actually have a protective effect, even in those people who are not socially anxious, but if they have a genetic risk, it is found that probiotics has got a protective effect. So this second part is of interest for you, but please mind, next slide, next, yeah. So this study was on healthy medical students. It was done in 2016. Please don't do that, huh? It was just a study. So this was a double-blind study. Double-blind means the patient, the students, as well as the investigators, they did not know what the students were getting. It was a placebo-controlled trial, meaning one group received the probiotic, another group received the placebo. So they actually gave lactobacillus fermented milk, and the other group received placebo. For next 8 weeks, they have seen prior to exam. So it was found that there was a significant improvement in that group which received probiotic, that is lactobacillus. So this is one important plus, but please take it with a pinch of salt. Tomorrow on, don't start using it, okay? So next slide. So this is about schizophrenia. So yeah, so schizophrenia is a major mental illness. what happens is there's something called treatment-resistant schizophrenia. What happens is many patients with schizophrenia, they do not improve with routine treatments. So it is found that if you give oral microbiomes, there's a little bit of improvement in such patients. But this one particular study was recently published in my journal. So where they found that probably oral microbiome is a potential biomarker for predicting such patients who will develop treatment resistance. So next slide. So these are the various strains which have been shown to link with neuropsychiatric disorders. I'm not going to read out. There are lots and lots of strains which have been studied world over. Okay, so what are the dosages? So there are a lot of molecules available. The current evidence is mostly for depression and anxiety disorder. That also, they are saying that it may not be useful as a monotherapy. It is useful as an adjuvant therapy, means they will receive regular treatments. For example, they will be receiving antidepressants and you add probiotics as a add-on to the existing antidepressant drugs. So these are the way, it is 23 billion colony forming units. So this is called CFU in short. Once a day you have to give for 2 months. So it is found that there is some improvement. So this is what is the dosage recommendation for a particular formulation which is available in India. There are lots and lots of formulations which are available. Okay. So what is very important is to be a little cautious, because most of the studies which have been published to date have been preclinical, means they are not really so well conducted in real life population. For example, you are going to say Usmania Medical College where thousands of patients are there and you are doing such studies there. So that's a real life study. So in such huge population, studies have not been done till now. And whichever small studies have been done, this sample size was very small and there were a lot of confounding variables. Confounding variables basically mean what are the other factors which could have led to improvement. So it may not be just probiotics. People may be getting a lot of other things also in their life, which also could have confounded the result. So what is very important is there's a need to translate the findings what I have presented to the clinical practice. So to summarize, the research on brain gut axis and psychiatric disorder has grown rapidly since 2013. The most common psychiatric disorders where there's some evidence is depression, anxiety, and autism spectrum disorder. Schizophrenia and other major mental illnesses, there's very limited evidence. Probiotics has got potential therapy for psychiatric disorder. There's a very important need to do a proper long-term follow-up studies before we can really do it in a clinical practice. So when I was preparing this presentation, I was just wondering, see, I am one person who always believe that religion and spirituality should not be mixed in our academics. But I was just wondering, like we have been using cow dung in our day-to-day practice for like few religions use it. Is there any reason? And that also only cow, not ox or not even buffalo. So what could be the reason? Probably this is a food for thought. So I hope people will take up such research in their future. Thank you so much. And I'm open to questions.
Thank you so much, sir, for your wonderful words. As we have had the privilege of hearing truly insightful thoughts and ideas, now it's time to open the floor for questions.
We want to hear from our audience your thoughts and reflections on this discussion. Online and offline audience, please feel free to raise your questions. Our guest speaker, Dr. Rajashekar sir, will be happy to answer and engage with you.
Let's make this an interactive and enriching sessions with exchanging ideas.
Okay. Hello, sir. Hello, sir. Hello, sir. Can I ask one question? Congratulations, sir. It was a very nice and informative session. I just want to ask, as a pediatrician, sir, you said ADHD symptoms manifest mostly around 3 years. True, but early signs around 1 year, if we see, can we put prophylactic probiotics there to help the children? Like routinely homemade, we say curd and all are good, but can we prescribe anything where we are seeing nowadays, because there are nuclear families where the interaction with our social this thing is only less for the child. So should we prophylactically prescribe probiotics? What is your take on that, sir?
Yeah, thank you, madam. As much as I know, like Yeah. Hello. Yeah. As much as I understand, generally what I do is like when it comes to ADHD or even autism, generally I do not prescribe medication before 6 years of age, unless until the symptoms are very severe and very much impairing to the child or to the family members. I do not have much experience with autism, but whatever literature I have gone through, I don't think there is any studies on children before 3 years of age. And most of the studies have been done on little older children. And one more thing is I think the regular probiotics, what are available in market, the composition is very less as compared to what is actually recommended in these studies. That's what, madam. I think curd and all that, I think in our day-to-day practice, we should definitely encourage because it has got a lot of good qualities. So probably that is what has been helping children in our country for so many years. Thank you, madam.
Thank you so much, sir. Thank you.
Thank you, madam.
Hello, sir.
Yeah.
Sir, in India, children who are suffering from autism, are we are we giving them probiotics, sir?
Yeah. No, that's what, madam. Actually, like I was telling that this is whatever evidence I have presented is mostly limited to the studies what has been conducted. In real life situation, I don't really think that people have started writing probiotics for children because the evidence is very limited. Whatever is I have presented is mostly in the clinical trials. They are RCTs, but not like real life pragmatic studies. So I'm not aware of people whether anybody is really prescribing it in their day-to-day practice.
Sir, but do you think if we suggest, there is no harm, no, sir? If we suggest probiotic,
Yeah,
there is no harm. So, but
possible.
it be helpful also, sir.
Possibly, yeah, yeah.
So, I think India, we should start that. What do you think, sir? What is your comment about this?
True, madam. True.
Thank
Probably
you, sir.
yeah, yeah. Thank you. Yeah.
You are saying something, sir?
No, nothing.
Thank
Good afternoon, sir. Thank
Yeah.
you for a very informative session. I had mainly two questions. First was that in autism spectrum disease, usually are all the gut-related symptoms inbuilt or are they developed later in the life? And if we are prescribing any kind of diet for the patient, so will the same changes help the other people also, or it might vary because it is kind of inbuilt the disorder, the symptoms, right?
No, see, one thing is autism is as biological as any other disorder. It is not just like, even if you, I think in the best of environments, people can still develop autism. And many of the clinicians say that probably autism is more common in people from upper socioeconomic status. There are no studies in that, but mostly my fellow colleagues say that they have seen people, the parents are actually from IT companies and their children have autism. So it is something definitely biological in nature. So whatever treatments we are doing are just we are doing from outside, but it cannot really cure the inbuilt problems. And another thing is the pharmacological is only one part. You have to look into other non-pharmacological treatments. There are a lot of behavioral modifications and all that you need to do. And the second question I did not understand. What was it?
Then it was like that only.
Okay.
And sir, one more thing, can the gut microbiota analysis be further used in future as a biomarker for psychiatric disorders? Like,
Yeah, that's what I had presented, no?
yeah.
In one of the studies, the one on schizophrenia, they are saying that schizophrenia is a major mental illness. There are few patients who respond to treatments, other patients do not respond. So this particular study actually was saying that probably the oral, whatever, this is a possible biomarker for people who are not going to respond to treatment in patients with schizophrenia. So what you said is right. Even in other psychiatric disorder, probably it can be a biomarker. Yeah. Thank you. Thank you.
Thank you so much, sir, for your incredibly enlightening and thought provoking insights on gut brain axis, and also inspiring us to think deeply how we can apply these ideas in our own lives and work style.
We are truly grateful for time and effort you have put in, sir, for sharing your expertise with us today. Now, we welcome Professor Dr. A. Shantakumari ma'am, Organizing Chairperson, and Dr. Suman sir, Organizing Secretary of CPD program, for felicitation of our Chief Guest Speaker, Dr. B. Rajashekar sir.
Let's give a warm and hearty round of applause.
Munaza, don't you think we must have something interesting, fun activity after having such a great learning session?
हाँ कृष्णा, मेहरबान कदरदान, दिल थाम कर बैठिए। अब आपके सामने पेश है क्लासिकल सॉन्ग।
Yeah, such mein. By the way, classical music has the power to touch our soul and make us feel incredibly happy.
So let us welcome our next performer to the stage, Power Vanilla, who will be enhancing us with beautiful classical song.